Good morning, guys. I have discussion A for you. We're discussing the key to caring for aging parents. Accept that you can't fix everything, based directly on the article you're viewing. What the phrase means in the context of the article. The article argues that caregiver well being doesn't come from mastering every task or eliminating every problem, but from accepting the limits of what any one person can do. Caring for aging parents is described as exhausting, unpredictable, and emotionally heavy. The piece the piece emphasizes that trying to fix every decline or challenge only deepens burnout. Instead, the article frames acceptance as a form of strength, accepting that a loved one can't do what they once did, accepting that personalities may change, especially with dementia, accepting that anger, guilt, fear, and sadness are normal caregiver emotions. Accepting that being present is often the most meaningful thing you can offer. This shift from fixing to accompanying becomes the foundation of sustainable caregiving. Why acceptance matters. The surrounding content highlights several reasons acceptance is essential. Caregiving is emotionally and physically intense. The article cites national data showing that nearly two-thirds of caregivers report moderate to high emotional stress, and 70% experience physical strain. Trying to fix everything only increases that load. 2. Aging brings irreversible changes, decline, dementia, and personality shifts aren't solvable problems. The article stresses that well being comes from acknowledging reality rather than fighting it. 3. Presence is not more powerful than perfection. One caregiver quoted in the article says, I showed up today as best as I could, and I will try again tomorrow. That mindset, showing up rather than fixing, anchors the peace. Caregivers need support, not superhuman expectations. The article underscores the importance of peer support, employer flexibility, and respite care. Accepting limits makes it easier to seek help. Caregiving is unpredictable. A fall, a new diagnosis, or a sudden shift can upend even the best plans. Acceptance helps caregivers adapt rather than blame themselves. The deeper message. The article reframes caregiving as accomplishment, not rescue. You you can't stop aging, reverse dementia, or prevent every crisis, but you can offer steadiness, dignity, and love, and that is enough. This is a theme you and I have explored often. Human care isn't about control. It's about presence, boundaries, and guardrails, and the shared work of sustaining dignity over time. This article sits squarely in that philosophy. If you want, we can turn this into a podcast segment, a handout for caregivers, or reflective framework for workshops. Okay, guys, second half will be coming up shortly here. Second half is dealing with aging parents and challenging behavior, how to cope. Okay, that's the second half of today's show. Based primarily on the care.com article you have opened, what the phrase means in the context of the page. On this page, the phrase introduces a practical, emotionally honest guide for adult children who are caring for parents whose behavior has become stubborn, dismissive, resistant, or even hostile. The article frames challenging behavior not as a moral failing, but as a signal of deeper emotional, medical, or cognitive issues. The core message: you can cope more effectively when you understand what's underneath the behavior, set boundaries, communicate differently, and bring in support when needed. What's really behind the challenging behavior? The article emphasizes that what looks like stubbornness is often rooted in fear of losing independence, loneliness, and shrinking social worlds, pride and the desire to maintain dignity, anxiety that shows up as controlling or refusing change, depression, which often appears as irritability in older adults, cognitive decline, which can masquerade as personality change. This reframing helps caregivers take things less personally and respond with more clarity and compassion. How the article suggests coping. The page outlines several strategies that help caregivers navigate difficult interactions without burning out. Leading, leading with empathy, acknowledging the emotion behind the behavior. I know this is frustrating, reduces defensiveness, and helps de escalate. Use collaborative language. Phrases like, let's figure this out together, helps parents feel included rather than overruled. 3. Keep conversations short and focused. Long explanations can feel like lectures and increase resistance. Start with their values. Instead of logistics, you need to move. Begin with what matters to them. You've always valued safety and independence. Coping with family dynamics. The article recognizes that siblings often disappear or disagree, leaving one person to carry or one person carrying the emotional load. It recommends regular family check ins, shared calendars or care apps, clear divisions of responsibilities. Guys, when you have parents who are elderly and getting memory issues, you have to work as a team. You can't leave things on one person. You have to share responsibilities. Accepting what you can't control. When siblings won't participate, this helps reduce resentment and keeps communication predictable. Boundaries as a coping tool. A major theme. Boundaries are not selfish, they're essential for sustainable caregiving. Examples include, I can talk about this tomorrow, not tonight. I won't stay on the phone if I'm being yelled at. I can help on weekends, but not every day. These boundaries protect your energy and prevent emotional exhaustion. Caring for yourself so you don't burn out. The article stresses that burnout is common and often sneaks up slowly. It recommends structured breaks. Grounding techniques, breathing, meditation, therapy or support groups, recognizing fatigue before it becomes a crisis. One caregiver quoted says, families don't break into a single moment, they wear down through exhaustion. When coping isn't enough, if communication stalls or safety becomes a concern, the article encourages bringing in professionals. Geriatric care managers, area agencies on aging, social workers, therapists, or geriatric psychiatrists. Patients often listen to neutral professionals more than their own adult children. The deeper message. The page closes with a compassionate truth. Understanding your parents' behavior doesn't make it less exhausting, but it can make it less lonely and less personal. Coping means balancing empathy, boundaries, and realistic expectations, outside supports, or your own well being. And sometimes the most loving act is recognizing when you need a break. Okay, guys, that's your A for today. I will see everybody on Monday for shows. For now, Gator Wellness. Take care, folks.